present here. Okay. So impulse control disorders are an important topic. And welcome to all of you for this academic session. And again, if you feel that you want to ask me any question or you want to say anything, just let me know. I will try to keep checking the chat box. I am not very sure how much I'll be able to do so, but overall, मैं देखता रहूँगा. So if there is any question, you can just let me know, and I will try to respond to that question. Faiz, Ahmed Faiz is a beautiful poet, and I love his poetry, and I always used to recite the verses written by him, which are very much closer to psychiatry. So I always feel that Faiz, most of the poetry by Faiz is psychiatry, so I love it. So start यहाँ से करते हैं. छिनती हुई नजरों से जज्बात की दुनियाएं, बेख्वाबियां अफसाने महताब तमन्नाएं. Look at the words. बेख्वाबियां अफसाने महताब तमन्नाएं, कुछ उलझी हुई बातें, कुछ बहके हुए नगमे, कुछ अश्क जो आंखों से बेवजह छलक जाएं. This is too deep in psychiatry, and sometimes if I'll have time, I will definitely try to tell you about the details about it. Now, today's topic, the impulse control disorder. Unfortunately, it's an old presentation and I was not able to modify it. So I'll be quoting DSM-IV-TR. But as far as I know, nothing much have changed in these disorders, except they are put in a different categories. So bear with me and try to update yourself with it. So intermittent explosive disorder is the first impulse control disorder. And the DSM-IV criteria includes several discrete episodes of failure to resist aggressive impulses that results in serious assaultive acts or destruction of property. The degree of aggressiveness expressed during the episodes is grossly out of proportion to any precipitating psychosocial stresses. The aggressive episodes are not better accounted for by any other mental disorders, for example, antisocial personality disorder, borderline personality disorder, conduct disorders, ADHD, mania, psychotic, and are not due to physiological effects of substance abuse and, of course, medical problems. Now, if you look at this definition and then see around you, आप जब सड़क पे जा रहे होते हैं और आप देखते हैं कि दो गाड़ियां आपस में लग जाती हैं, so they bang to each other, and then you see that in Pakistan it's very common that lots of people gather around and there are two people fighting with each other and they are trying to justify who is right, whose fault was it. I have never come across again with something, but this is the definition which fits in. So it is discrete episode of failure to resist aggressive impulses that results in serious assaultive acts or destruction of property. So either you damage yourself or you damage the other person or you damage something else, but you are in such an aggressive mode that you fail to lose the sense of it. This is what intermittent explosive disorder is. Even if you look around in your family, there are times, there were a few candidates which were talking in the past about these episodes where people bang their heads against the wall, people try to hit against the wall, or they slap forcibly on the table, or they try to come forward with an aggressive attitude. They may be otherwise normal individuals in day-to-day life. So they go to the office, they are not depressed, they are taking care of their families, they are earning money, blah, blah. But they have this sudden episode where they burst and they try to show their anger in such an aggressive way that people are surprised what happened to this man. He's such a well-mannered person, but why he lost his temper. Now, this is the situation which comes in there. Intermittent explosive disorder. So a disorder where you are not able to control your anger, which comes for a short period of time, but it is so much that people are surprised around you. And this is intermittent explosive disorder. Then the gender differences is more common in men, understandably, because men are physically otherwise aggressive and big physique. So it's more common in men. Prevalence, now this they say it's rare. But if you look around again, as I told you, and look around in the news and look around in the television and look around in the media, the TikTok and all that stuff, so you will see that this is not very rare. It's actually common if you look around. And people do have episodes of aggression. Like there is a mob psychology. So in the past, there was here just about a couple of months ago, there was a black man killed, and unfortunately, so I should not use the black man. So there was a man killed in US, which unfortunately was of a different color and origin, and there was lots of protests against it. So the community should have equity. They should have the same right. They should be talking on the same page. Now that is important. So that when the protest is there and the mob psychology is there, people are in an aggressive mode. Although they are well balanced people otherwise, but when they go into the mob, when they are protesting, they have certain episodes where there is an intermittent explosive disorder. So it's rare, but not so rare. So it's common, but it depends on other situations as well. Course is variable, it's chronic or episodic. So it comes and goes. That is the tricky part. So in between probably 6 months, there is no problem. Everything is okay. People are fine. They are acting fine. They are behaving fine. But suddenly they explode into a severe outburst of anger where they are not able to control themselves, and they express their anger in a way which could be harmful to the people around. Course and onset is usually in early 20s. So it's not related to schizophrenia. It's not related to bipolar. Now, if contributing factors, so there are multiple contributing factors. Like in behavior theory, they say that there is antecedent. So a sense of tension or arousal, any stress which can precipitate that sudden surge of anger. Explosive behavior, aggressive episodes, and immediate consequences, a sense of relief and sense of and release. So as soon as you explode, you express your anger, you are hyper, you are aggressive, and you show it. After 5-10 minutes, it settles down on its own without any intervention or treatment. That is more, again, problematic. Delayed consequences. So feeling upset, remorseful, regretful, embarrassed about the aggressive behavior. So बदतमीजी कर दी, बॉस के साथ बदतमीजी कर दी, पेरेंट्स के साथ बदतमीजी कर दी, कोलीग्स के साथ, फ्रेंड्स के साथ, और शदीद बदतमीजी इस हद तक के गुस्से में आप इसे बाहर हो गए, सिंपल वर्ड्स में, एंड लेटर ऑन रिग्रेट दी थिंग्स एंड दे थॉट, ओ ये मैंने क्या किया, ये मुझे नहीं करना चाहिए था. So sometimes you go back, you apologize, you say sorry and things like that. But it's important. Now, personality factors, generalized impulsivity or aggressiveness, chronic anger management problem. Now, again, the psychologists talk a lot about anger management, and it's part of your, again, behavioral sciences as well, the anger management strategy. So this anger, which is sudden and explosive, needs to be controlled through those strategies. Childhood history of temper tantrums. Now, this is a very strange word, temper tantrums. Temper tantrums, बच्चे अक्सर, you look around and you see, वो नखरे करते हैं वालिदैन के साथ, अगेन वो कहते हैं गुस्से का इजहार करते हैं, किसी चीज की डिमांड में शोर मचाते हैं. So that is important part of the, again, development process, where we have to understand that these temper tantrums can lead to future psychiatric problems as well. So they need to be addressed properly. Impaired attention, hyperactivity, and other behavioral difficulties. Now, if you compare the children in the West and in Pakistan, my son used to say to me that when I'm very polite, I'm very nice, I'm very lovey-dovey with him, he says, "Are you okay? Why you are behaving like this?" So sometimes ईस्टर्न सोसाइटी में, जिस सोसाइटी में हम रहते हैं, माँ बाप का बहुत ज्यादा पोलाइट लवी डवी हो जाना भी कभी कभी एबनॉर्मल लगता है. सो आप यूजुअली, और वेस्ट में दे आर ऑलवेज लाइक, बच्चा रो रहा है, चीख रहा है, कोई रिएक्शन शो नहीं करना, वो जमीन पे लेट गया, उसने अपने कपड़े गंदे कर लिए, उसने अपने आप को खराब कर लिया, कोई रिएक्शन नहीं शो किया, और जब वो थक हार के रो पिट के थक गया तो फिर उसको उठा के आगे चल पड़े. सो the way we manage the children in the West and the East is quite different. In East, we always try to snub them. Chup karo, kya kar rahe ho? Baith jao, khade ho jao. Like these kind of things, which unfortunately are problematic, and in the longer run gives rise to a lot of psychological and psychiatric morbidity. But when you just try not to address these temper tantrums, not to give them the way they want the things to be done, blackmailing situation, and if you try to control it properly, then of course the outcome and prognosis is different. Early learning, modeling and parenting styles and family conflicts. Now, children do see both the parents fighting with each other. बाप साहब घर में घुसे, आते ही उन्होंने शोर मचाया, ठीक है, खाना मिला, खाने को लात मार दी कि जी खाना अच्छा नहीं है पका हुआ, गुस्से का इजहार बिल पे कर दिया, पैसों पे कर दिया, इंटरेक्शन में कर दिया. Now these parenting styles and family conflicts are unfortunately problem. सास के बहू से झगड़े हो रहे हैं, बहू के सास से झगड़े हो रहे हैं, एक जॉइंट फैमिली सिस्टम में रह रहे हैं, इंटरेक्शन खराब हो रहा है. And most of these things, they lead to psychological and psychiatric morbidity in future. So this is important in intermittent explosive disorder psychopathology as well. Then biological factors. Low levels of serotonin and norepinephrine is considered to be one of the reasons, and that is the reason why we try to treat it with some SSRIs or SNRIs. High levels of testosterone are also seen. This is surprising because male hormone testosterone had got a lot to do with the intermittent explosive disorders, and stress, of course, is the key. Now, the second impulse control disorder is kleptomania. Kleptomania, recurrent failure to resist impulses to steal objects that are not needed for personal use or for their monetary value. Now, long time ago, when I was a child, very young, there was a big politician lady who stole something from one of the big stores in UK. And that was the news in the papers, and a lot of people criticized that. Why this lady was caught stealing something very small from such a big store, and she was rich, so she was able to afford that. So why she never paid for it? Why she stole it and hide it somewhere? Now, I am not sure, but now again in Pakistan with the big malls and the big stores, there is definitely people who steal things. It could be because of the poverty and other things, but it could be unnecessary. If person takes up anything, like you go to the classroom, you see the child, and they pick up a rubber from the fellow who's sitting next to them, pick up a pencil, and then hide it, and they bring it home. Although they don't need that pencil, they don't need that rubber because they have their rubber of their own, but still they pick it up and just hide it. The intention is not stealing. The intention is certain urge, which is unfortunately in form of an impulse to pick it up and hide it. This is important, and this is common. Again, if you look around you, you'll be able to find so many people who does that. और मेरा ख्याल है हर क्लास में एक बच्चा ऐसा जरूर होता है जो बिला वजह लोगों की चीजें उठा के घर ले जाता है, and then people try to find it out. Now this is common It's not very uncommon, but again, you have to look for it. Increasing sense of tension immediately before committing the theft. So there is an urge to pick it up, and that urge, unfortunately, you are not able to control, and then you pick it. And then as soon as you just keep it with yourself, your urge goes down. But that pathological stealing is unfortunately the problem. Okay, so going ahead, the stealing is not committed to express anger. Increasing sense of tension immediately before the committing, pleasure, gratification, or relief at the time of committing the theft. The stealing is not committed to express anger or vengeance and is not in response to a delusion or hallucination. The stealing is not better accounted for by conduct disorder, manic episode, or antisocial personality disorders. Now, these three things are important as well. So just sudden urge of stealing something, picking it up, which is not required, hiding it, and that urge goes down. And it is not conduct disorder, it's not borderline personality disorder, it is not antisocial personality disorder, and you have done that. 2/3 to 80% are female. Now, this disorder is more common in females. So, why is it more common in the females? Probably because of the socially, because of the, again, feminist thing, because of probably impulsivity. I don't know what is precise reason why it's more common in the female, but you have to be careful that kleptomania is more common in females. Occurs in less than 5% of identified shoplifters. Prevalence in general population is rare and unknown. Now, because these disorders are important for the exam, so you should know them. Clinically, you will be able to find them very commonly, but usually they are not given the weightage because they are not compromising the quality of life unless or until they are caught, which is unfortunately a bad thing. So I believe that if you are able to assess it and pick it up, then you should try to intervene and correct it rather than making it go on and then things getting complicated. Course is sporadic with brief episodes and long periods of remission. Now, this is the complication. So people do get well and they don't do it for a year, and then they will do something that again for a short period of time. Episodic with protracted periods of stealing and periods of remission. Chronic with some degree of fluctuation. Variable onset, early onset in treatment for women. So if it occurs, say in the late childhood, which is adolescent time period, somewhere around grade 8th and 12th, that is more common. And then afterwards, it usually regresses and disappears. But still, you have to be careful about it. Ego dystonic. Person is aware that the behavior is wrong and senseless. Person is usually a law-abiding otherwise. So it's not something which is in his control. Contributing and relating factors, associated disorders and behaviors, compulsive shopping, mood disorders, eating disorders, bulimia, personality disorders, and other impulse control disorders and substance-related disorders are common overlapping features. So if you diagnose a person with a bipolar disorder and he is stealing as well, so you can say the comorbidity is high, although you will treat the mood disorders, but you have to consider kleptomania as one of the important things in your diagnosis. And if you'll say it, of course, you will have a good marks if you want to get them. Childhood experiences, stressful and tremulous childhood, sibling rivalries, separation from parents, neglectful parenting. In all of these disorders, one thing is very clear that most of the things they develop in the childhood, and most important contributing factors in all of them is bad parenting style. So the aggressive, dominating father, having joint family system where there are lots of disputes and again fights going on, these things are important factors. So there are advantages of living in a joint family system but there are some problems as well if the family is not getting along properly. And this is common in Pakistan. I have seen so much. So I would definitely say it's not rare, it's common. And psychoanalytical theory says that defense against or catharsis for underlying anxiety and anger. But behavior people again says there is antecedent, tension, unpleasant feelings, खावन से लड़ाई हो गई, अब्बा ने डांट दिया, भाई ने चीजें नहीं दी. So these things can have contribute. And delayed consequences, people do feel depression, guilt, remorse, legal problems, which I mentioned to you earlier as well, family, career, and personal difficulties. That is important because if it comes in again in legality, then in West you won't be able to find a job because there is a legal thing available at the back of the background check that this person was caught stealing something which was irrelevant. So it's a complication. Pyromania. Again, the third impulse control disorders, pyromania. You must have seen the children when they are very fascinated, when they are very much excited, and when they are talking to each other or playing with each other, they love to ignite fire and play with it. So कागज को आग लगा के देखते हैं और लाइटर जला के देखते हैं और माचिस की तीली जला के देखते हैं. So those things you have to try to understand if it is just for fun's sake or it is really an impulsive act. So deliberate and purposeful fire setting on more than one occasion. So माचिस की तीली जला जला के फेंकना और उसको देखते रहना और बार बार और उसको एक अपने आप को उसको relief feel करना. Now this is important. So pyromania and again arson. Arson is a legal term for pyromania where people burn houses, people burn places, people burn cars. Like हमारे यहाँ जलसे जुलूसों पे होता है, गाड़ी को आग लगा दी, बसों को आग लगा दी, पुलिस की गाड़ी को आग लगा दी, कोई गाड़ी को जला दिया. गाड़ियां जलाना तो it's a very common problem when there is a mob or again. So setting up of a fire is pyromania, more than one occasion. And this is again something very problematic because you set up a fire just to say for the sake of your own impulsive act. So it is problematic. And if there is legality involved in it, it is called arson, and arson itself is a crime, and then it is punishable crime. So tension or effective arousal before the act. दिल करता है माचिस की तीली जला के इस तरह फेंकूं और देखूं क्या होता है. दिल करता है इस कागज को आग लगाऊं, क्या होगा? फट जाएगा. ठीक है. दिल करता है इस सिलेंडर को आग लगा के देखूं क्या होगा. Right? So those kind of things and urges, you have to be careful. And it is again very common around you if you really start looking for it. Fascination with interest and curiosity about or attraction to fire and its situational context. For example, paraphernalia uses consequences. आग लगाऊंगा क्या होगा? गाड़ी को के टैंक में तीली डाल दूंगा माचिस की क्या होगा? Let's see what happens. Now that kind of an excitement about the consequences, they are problematic. And again, it's complicated. Pleasure, gratification or relief when setting fires or when witnessing or participating in their aftermath. आग लगे हुए देख रहे हैं खड़े हुए, and you are trying to enjoy. Oh, look at the flames, how high they go. Now, the problem with it, if somebody's car is burned, imagine how much loss he had. But the people around it, they are just standing and looking at it. Oh, they just set the car on the fire, and now I'm standing and looking at it, and wow, what are the flames? Look at the paint burning. Now it's blue, now it's green. Look at the fire flames. So this is, unfortunately, when you start saying these things, it's not normal. It's not normal. It's definitely a problematic situation. The fire setting is not done for monetary gain as an expression of socio-political ideology, to conceal criminal activity, to express anger or vengeance, to improve one's living circumstances in response to a delusion or hallucination. And Again, as a result of impaired judgment, so mental retardation, IQ compromise, that is different setting. The fire setting is not better accounted for by conduct disorder, manic episode, or antisocial personality disorder. So pyromania is associated with considerable planning and advanced preparation for starting a fire. It not happens straight away. Although it is an impulse control disorder, but sometimes you feel, okay, let's go outside, pick up a matchstick, burn it up, and see what happens. Reaction to fire setting, gratification, pleasure, release, reaction to consequences, indifference or satisfaction, consequences of behavior, property damage, legal consequences, injury, loss, life to fire setter or others. Comorbid disorders, substance abuse is very common, and individual factors, poor social skills, learning difficulties, sensation seeking, attention seeking is important component. Then environmental cues, environmental factors, limited supervision, parental lack and lack of involvement, pathology, stressful life events, and physiological factors, low levels of monoamine oxidase. That is important contributing factor. Pyromania, although fire setting is major problem in childhood and adolescence, pyromania is rare. Juvenile fire setting is usually associated with ADHD, conduct disorder, or adjustment disorder. Now, these three disorders, when I'm talking about the family conflicts, when I'm talking about the ADHD, or talking about the conduct disorders or other processes, you are just wondering these things usually you don't ask when you are assessing patients in wards, and this is unfortunately a problem. We should assess for ADHD, conduct disorder, and adjustment disorders as well, but we don't do that. Although an important component in the history is the family history. And in family history, you try to dig out the information related to the family morbidity, psychiatric morbidity. But you also want to know the relationship between a person who's presenting to you with the mother, with the father, with the siblings. Now, how many times we write in history, there is a history of sibling rivalry. How many times we do that? Probably nil, never. I haven't seen any of my residents write it. There is a history or evidence of sibling rivalry. There is history of domestic violence. There is history of, again, father being abusive in a relationship. People don't do that. But in psychiatry, and when you are taking an appropriate history, these things are very important. And you all residents, one of the reason why I wanted to pick up this topic was this, that when you are taking a family history, please try to focus on the relationships patient is having with his siblings, with his mother parents, how much is the domestic violence, and how much problematic is the social situation in the house. And most of the time, we do ask about the financial problems. We do ask about the job uncertainty, but we don't ask about these things, and they are important. More common in males. So, लड़के ज़्यादा जाके आग जला के experimentation करते हैं. Less in females. Episodic fire incidences may occur with wax and waning frequency, and again, more common in Caucasians, white males. So just to have a small break again, ये भी फैज़ की एक नज़म है और ये मुझे इसलिए पसंद है कि इसमें भी बहुत psychiatry है. So I love the poetry again, as I mentioned to you earlier, which relates to psychiatry. And they say, पूछ से पहली सी मोहब्बत मेरे महबूब न मान. इसका सिर्फ आखिरी जो बंद है वो सुनाऊंगा. अनगिनत सदियों के तारीख बेईमाना तिलिस्म रेशमो अतलसो कम ख्वाब में बनवाए हुए, खाक में लिथड़े हुए, खून में नहलाए हुए, लौट जाती है उधर को भी नजर क्या कीजिए, अब भी दिलकश है तेरा हुस्न मगर क्या कीजिए, और भी और भी दुख हैं ज़माने में मोहब्बत के सिवा, राहतें और भी हैं वस्ल की राहत के सिवा, मुझसे पहली सी मोहब्बत मेरे महबूब न मान. So, considering the social, cultural, poverty, economical problems around us, I don't know. We still believe in seeing the plays played on TV. The other day, I was looking at the WhatsApp. There, somebody sent it to me, and there was a very nice message actually. तो उसने कहा जी मैंने हम टीवी लगाया तो उसमें एक ड्रामा चल रहा था जिसमें उसकी बीवी किसी और बंदे में इंटरेस्टेड थी. दूसरा चैनल लगाया तो उसमें उसकी जो लड़की थी वो जो थी वो अपने पत्नी किसमें इंटरेस्टेड थी. तीसरा लगाया तो उसमें जो सौतेला बाप था वो अपनी सौतेली बेटी में इंटरेस्टेड था. और फिर अगला चैनल लगाया तो उसने कहा कि इज इट आवर कल्चर, डू वी सी दीज थिंग्स? They are fascinating things actually. Hypothetical, situational, अफसानवी किरदार जो शायद हमारी इनर फीलिंग्स के मुताबिक होते हैं, इसीलिए लोग इन ड्रामों को बहुत देखते हैं. क्या हुआ, कैसे हुआ, बट इज इट रियली क्लोज टू आवर एक्चुअल थिंग्स? I'm not sure about it. So I really liked that clip that, of course, we have to assess, is it really happening around us or it's just hypothetical situations? So as a psychiatrist, please try to see these social contributing factors to psychiatric morbidity very closely and take them into consideration. Is it really happening or is it just the imagination? Pathological gambling. Now, people feel that probably pathological gambling again is less common, but I can assure you, I have seen back again in Pakistan as well and other places as well that gambling is quite common. Cricket gambling हो रही है, ठीक है, और कोई और गेम ले लें, gambling is common. खासतौर पे क्रिकेट में तो पाकिस्तान में बहुत बड़ी gambling होती है, and it's not a hidden fact. Probably it's probably known to most of the people. So I'm not talking something which is secretive. So people do gamble and they gamble a lot on these things. Although in the Western world, there are specific places where you can go and gamble, and you believe that in Pakistan and Eastern countries, probably it's not like that. No, there are places there as well where people can go and gamble. All it is that in some places it's legal, with restricted and appropriate things, and at some places it's illegal and problematic. But pathological gambling is a problem. Now this is again persistent and recurrent maladaptive gambling behaviors as indicated by 5 or more of the following. Is preoccupied with the gambling. So reliving past gambling experiences, planning the next venture, thinking of ways to get money to gamble with, needs to gamble with increasing amounts of money to achieve the desired excitement, has repeated unsuccessful efforts to control, cut back or stop gambling, is restless or irritable when attempting to cut down and stop gambling, and gambles as a way of escaping from problems or relieving a dysphoric mood, for example, feelings of helplessness, guilt, anxiety, or depression. So it is, again, if you look around, quite common. After losing money, gambling often returns another day to get even, chasing one's losses. बस एक और फिर ये सारे पैसे वापस. Lies to family members, therapists, or others to conceal the extent of involvement with the gambling. People don't tell about it. Unless or until we'll ask them, they won't disclose their information about gambling. Has committed illegal acts such as forgery, fraud, theft, embezzlement, or financial embezzlement for gambling. Relies on others to provide money to relieve a desperate financial situation caused by gambling, and the gambling behavior is not better accounted for by a manic episode. So a manic patient also does the same, but it's different. Distortion in thinking. I hope I'm still there, not lost you people. अगर मैं ज़्यादा irrelevant गुफ्तगू कर रहा हूँ तो मुझे बता दीजिएगा. काफ़ी लोग बीच में से छोड़ के गए, so I'm sorry about that. So if you feel that this is okay, we'll just finish up in 5 more minutes. Pathological gambling associated with contributing factors: denial, superstition, overconfidence, sense of power control, belief that money is the cause of solution to all other problems. Personality traits are important: highly competitive, energetic, restless, easily bored, generous, extravagant, overly concerned with the approval of others, and high levels of impulsivity. Workaholics or binge workers are unfortunately more bigger gamblers. And people having lots of stress like migraines, ulcer, hypertension, then it's a problem. And comorbid psychological disorders, which I have mentioned earlier as well. So that is a problem. Then, sorry about this. Okay, so pathological gambling facts and figure, more common. 1/3 are the female. Females are more likely to be depressed and to gamble as an escape. Females are underrepresented in treatment programs and Gamblers Anonymous. Cultural factors, variations are common. 1 to 7% is prevalent, which is quite high. Regular episodic gambling and onset in early adolescence. Trichotillomania. Now, this is again an important impulse control disorder. Last one, trichotillomania. I have seen in my life 3 cases of trichotillomania. So it is relatively less. But I have seen those women plucking their hair from the roots and getting bald from certain places. Or वो एक sudden urge or impulse to pick up the hair, pull it out to an extent that they don't feel pain. And then when they peel it off, that place is practically bald. So recurrent pulling out of one's hair resulting in noticeable hair loss, an increasing sense of tension immediately before pulling out the hair, pleasure, gratification or relief when pulling out the hair, and disturbance is not better accounted for another medical condition or other things. Now, this trichotillomania usually is associated with psychiatric morbidity, major psychiatric morbidity, if you'll be able to pick it up. Sometimes there is no psychiatric morbidity as well. So all the 3 cases that I saw, which I remember very explicitly, they were not having any other psychiatric morbidity. It was just trichotillomania. Otherwise, it's a common symptom as well. But when it's a symptom, people do pull out their hair, but they're not bald. They don't have a significant hair loss. But in trichotillomania, you can see patches of hair gone. So that is very significant. And triggers are, again, they are stressed, they have problems, hair twirling, examination of the hair root, pulling the strand between the teeth, eating hairs, nail biting, scratching, gnawing, excoriation, pulling hairs from other people or animals, pulling fibers from the objects, बैठे हुए वो फूल की पंखुड़ियों को उतारते रहते हैं. So we have to see that as well. More common in females, but they say they are equal. I haven't seen a single male. So all the 3 patients that were just trichotillomania, nothing else, were females in my observation. Unknown but more common than previously thought, 1 to 5% of college students. So ये 5% of college students means हर 5वां बच्चा जो है कॉलेज का वो अपने बालों के साथ खेलता है. लेकिन खेलना is not trichotillomania, right? इसको examine करना is not trichotillomania. Pulling it out from the root is trichotillomania to relieve the tension and anxiety. And onset is in adolescence, right? Okay, so impulse control disorders treatment, mostly the things mentioned here, the cognitive interventions, we have covered it. Behavioral interventions, we have covered it. Drug treatments include SSRIs and clomipramine. Now, if you look at this, there are 3 postulates I have given to you earlier. Involvement of, again, catecholamines, serotonin, and monoamine oxidase. And these are the three drugs which can help. So SSRI, SNRI, and clomipramine. So clomipramine is probably an SNRI or the newer SNRI as well. So my patient responded best to SSRIs and clomipramine, which is theoretically available as well. Otherwise, there are various other treatment programs available in the net as well, and you can go through that. That's all the presentation for today. And if you have any questions, I'm willing to respond to that. और अगर कोई क्वेश्चन नहीं है तो फिर मैं ये समझूंगा कि शायद आप लोगों को कुछ समझ नहीं आई या टॉपिक अच्छा नहीं था. सो नेक्स्ट टॉपिक वुड बी रेपो बिल्डिंग एंड एम्पैथी इन एग्जामिनेशन सिचुएशन. कोई और टॉपिक स्पेसिफिकली करना है तो बता दें.
थैंक यू सर, इट वाज अ वेरी नाइस एंड एलैबोरेट लेक्चर. सर हमारे पास आज 2 सीनियर्स आए हैं, डॉक्टर कामरान और डॉक्टर मुंतजिर मेहदी. सो उनसे भी पूछ लेते हैं कि हाउ ऑफन डू दे सी इन देयर क्लिनिकल प्रैक्टिस. एक सर लंदन और इंग्लैंड में और एक लोकल पेरिफेरी में, तो कितने कॉमनली ये देखे जाते हैं उनसे ही पूछ लेते हैं. आप लोग बारी बारी अगर बता दें अनम्यूट करके.
जी डॉक्टर कामरान पहले बताएंगे, वो मेरे से भी सीनियर है. सर अस्सलाम वालेकुम.
वालेकुम अस्सलाम.
बेसिकली
मैंने 2 पेशेंट्स देखे ट्रिकोटिलियोमेनिया के. एक तो हाफिजाबाद क्लिनिक में जब मैं माइंड ऑर्गेनाइजेशन के तहत जाया करता था, ही वाज अ टिपिकल केस और उसका भी आई थिंक बॉडी पैचेस अपीयर हो रहे थे और बिल्कुल, और इतने शॉर्ट टाइम होता है उसमें पूरी असेसमेंट भी नहीं हो सकती. लेकिन ये कि आई थिंक मुंतजिर भी मेरे साथ था उस ट्रिप में. और दूसरा मैंने हमारे यहाँ पे एक केस कॉन्फ्रेंस हुई थी डबलिन में, आयरलैंड में, जब मैं ट्रेनिंग कर रहा था. तो दैट लेडी शोड हर बाल पैच, इट वाज सो बिग, और उसने ऊपर से कमी करके तो उसको छुपाया हुआ.
कंट्रोल डिसऑर्डर्स वर exclusive or they were having some psychiatric morbidity?
I think they were exclusive to हाफिजाबाद का तो पूरी असेसमेंट नहीं कर सके थे, but in that Dublin case, I think it was exclusive.
Mostly as a symptom, it can be seen more commonly, but as an explicit disorder, it's relatively, again, different and rare. So, Muntazir, what do you say?
जी सर मैंने पायरोमेनिया के अलावा सारे देखे हैं इम्पल्स कंट्रोल डिसऑर्डर. कुछ तो अपनी ट्रेनिंग में
या you were not interested to see pyromania?
नहीं, मुझे अभी तक पिक नहीं हुआ, कोई मिला नहीं पेशेंट प्रैक्टिस में पायरोमेनिया का.
जो किताब ये कहती है कि रेयर है तो शायद रेयर है, लेकिन मैं जब इर्द गिर्द देखता हूँ और मैं पूछता हूँ कि मतलब बच्चों को खास तौर पे जो एडोलेसेंट मेरे पास आते हैं, टीनेजर्स खास तौर पे, कि कभी वो आग लगा के मजा आता है. अच्छा, इन सम ऑफ द ईस्टर्न पार्ट ऑफ दीज कंट्रीज लाइक इंडिया में वो पटाखे चलाने का बहुत ज्यादा रिवाज है. पाकिस्तान में तो खैर अब पटाखे मुश्किल से मिलते हैं, पाबंदी है, लेकिन वो पटाखे चलाने वालों में आपको पायरोमेनिया वाला मिलेगा. हैव यू एवर थॉट ऑफ इट?
शायद वेंटिलेट हो जाता है.
एग्जैक्टली वो पटाखे चला के वो इम्पल्सिविटी आग लगाने वाली वेंटिलेट हो जाती है. दैट्स ट्रू. और जो ट्रिकोटिलोमेनिया का कोई केस देखा?
जी सर, वो तो हमने सर्विसेज में भी देखा था, उसकी कॉन्फ्रेंस भी हुई थी, यहाँ पे भी देखे मैंने, और फीमेल्स ही देखी हैं. वो उनका बिल्कुल एक कॉइन के बराबर पैच बने होते हैं, और आमतौर पे वही ट्राइसाइक्लिक और ये फ्लोक्सिटीन के कॉम्बिनेशन को रिस्पांस देते हैं. तो लेकिन है प्रेवलेंट है बिल्कुल.
लेकिन अगेन मुंतजिर और कामरान दोनों से पूछूंगा, एग्जाम में इससे रिलेटेड सवाल आया था? तुम दोनों में से किसी को याद है?
सो वैसे डिस्कशन में होता है, अदरवाइज नहीं, मेरा नहीं ख्याल एक्सक्लूसिव. थ्योरी में भी शायद ये आर्सन आया हुआ है, पायरोमेनिया और पैथोलॉजिकल गैम्बलिंग.
अच्छा, मैंने जो पिछले 10 सालों के पेपर देखे तो मुझे एटलीस्ट 5 दफा पार्ट्स जरूर नजर आए इन चीजों के. या पायरोमेनिया के ऊपर छोटा सा पार्ट था, या ट्रिकोटिलोमेनिया के ऊपर पार्ट था, या उस पे था. और मैंने ये सोचा कि ये जो जब पार्ट आता है तो वहां पे वो जो एक कैंडिडेट बैठ के एग्जाम कर रहा था वो तुकबंदी में ले रहा था ट्रिकोटिलोमेनिया पुलिंग ऑफ एयर, तो हो सकता है कि उसकी डिस्क्रिप्शन वो मिस कर जाए, तो मैंने कहा ये बता दूं ताकि शायद वो ज्यादा क्लियर हो जाए तो बाद में इनको पढ़ना ना पड़े। सो दैट वाज द रैशनल। सो
लेकिन जी काफी इम्पोर्टेंट ये है डिस्कशन के पॉइंट ऑफ व्यू से भी, रिटन के पॉइंट ऑफ व्यू से भी, तो इसको टच किया जाता है एग्जामिनेशन में,
एग्जाम में टच किया जाता है। अच्छा, और अगला टॉपिक रैपो बिल्डिंग एंड एम्पैथी, इज इट ओके?
जी स्टूडेंट्स वैसे बताएंगे अच्छा है सर, क्योंकि उस क्राइसिस टाइम में ये नहीं हो रही होती रैपो बिल्डिंग।
हाँ,
लॉन्ग
एग्जाम
केस में
would you like to talk about something on pyromania, sorry, rapport building and empathy next time?
कर लूंगा सर, मैं ज्वाइन कर लूंगा, आपको कुछ ऐड कर दूंगा। वैसे तो आपका बड़ा अच्छा
अगर हम
कॉम्प्रिहेंसिव
ये करें कि मैं प्रेजेंटेशन अपनी शॉर्ट कर लूं और 10-10 मिनट आप और कामरान कुछ अपनी प्रेजेंटेशन भी कर दें, तो एक अच्छा जॉइंट वेंचर हो जाएगा। 5-10 मिनट मैं पर स्लाइड्स कर लूं, 5-10 मिनट आप कर लें, 5। सो एक MRC साइट, एक FCPS और एक एग्जामिनर, पास्ट एग्जामिनर के तौर पे 3 व्यूज कैंडिडेट्स को मिल जाएंगे एम्पैथी और रैपो बिल्डिंग के। व्हाट डू यू से?
जी सर, ठीक है,
डन।
वेरी गुड
सो
आइडिया सर।
हम नेक्स्ट डेट कुछ आपस में कर लेंगे फाइनल, एंड देन वी विल
सर
ट्राई।
रिकॉर्डिंग स्टॉप कर दें,
जी,
रिकॉर्डिंग ऑफ कर दें।
ओह सॉरी, रिकॉर्डिंग ऑफ।